The best way to decide on where to go in the new healthcare marketplace as an employer is to start at the beginning with the Affordable Care Act. This is really the landmark decision that drove the development of the health exchange marketplace for employers and specifically for active employees. The Affordable Care Act has many components that affect employer-sponsored care, including subsidies to low-income employees, including fees and taxes that employers will be subject to regardless of the model they use, and also fees and penalties that they'll be subject to depending on the model that they use. So understanding the impact on your specific workforce, and if there's no change, what the Affordable Care Act means to you will be the first and most important part of this decision. Once you understand the impact on the status quo of the Affordable Care Act, then you need to think about your workforce and what that workforce will look like and how it will be impacted by a potential change in your model and in the way you deal with healthcare. The other part of it is, what's the implied promise to that workforce and the employee value exchange? So many employers are quite paternalistic and don't want their employees to worry about their health care. Others are much more bottom line driven. So depending on your relationship with your employees and the way in which you manage them, you will have another decision point. Once you've made those two decision points, then is the time to consider an exchange model. And again, the exchange models are quite different. First, you need to decide if you want to offer traditional coverage, as you've done, or consider more of a defined contribution approach. You also need to decide, quite frankly, if you're going to offer benefits at all. But assuming you've made a decision to stay in the marketplace, then the decisions around the healthcare exchanges need to be considered. What is the service model? How will they treat your employees? What is your impact on their customer service? What are the underwriting implications, and how will they deal with other employers that come in and out of your exchange and your marketplaces over time? And just as importantly, what is the underlying coverage and plan designs that are going to be offered to your employees, and how do they compare to what you offer today? Obviously, the decisions can get overwhelming, and we've listed an awful lot of them here. As such, the challenge is to get all of these pieces on an apples-to-apples basis. At Sibson, we've developed a model called the Next Decision Tree to assist employers in walking through this in a systematic way.